Hi, hello everyone. Welcome back to Anime Talks. In previous class, we saw the procedure and the technique, like how it is performed, and those indications and contraindications of spinal anesthesia. But in this class, we will see the factors affecting the spinal anesthesia. Before going into this topic, if you haven't subscribed to Anime Talks, please go back and do subscribe also. The video, please click on the like button, and if you have any questions or anything, please write in the comment section. So we will move on to the topic, that is the factors affecting the spinal anesthesia. It means in what all condition that spinal anesthesia is affected. There are so many conditions, but I have mentioned only few of them. First one is type and the dose of the local anesthetic. We have different types of anesthetic, like we have bupivacaine, we have levobupivacaine, ropivacaine, we have lignocaine, we have. So these all the drugs have different characteristics, different duration of action, that and onset of action also. So depending on that, on those features, those anesthetic drug will act. So it depends on the which drug we are choosing to that patient. That is the type and the dose of the local anesthetic. If we are giving more dose of the dosage of that drug to the patient, there will be a more intensive blockage will be there. That is the type and dose of the local anesthetic. And next we have patient factors. Patient factors, in this we have three types: age, weight, and height. Age also plays an important role in the spinal anesthesia because elderly patients require lesser amount of drug compared to the adult patients, because in elderly patient what happens, there will be a decreased spinal cord volume and the increased sensitivity. Those older patients are very sensitive to the spinal anesthetic drug, and there will be less, like that spinal cord volume will be decreased. So there will be high, already those patients are very prone to the hypotension. If we give drug which will decrease the hypotension, they'll go into severe hypotension. So in that condition, we will give lesser amount of drug compared to the adult. So that age factor also plays an important role in the spinal anesthesia. And next we have weight. For obese patient, we have to adjust the dosage. Sometimes they may require more dosage drugs, because their anatomical like structures will be more, and the subarachnoid space is very narrowed. And if the patient is very severe obese, then it is very difficult to uh, palpate the spinal cord and that space, that level. It's very difficult to identify the structure. So that weight also plays an important role in the spinal anesthesia. That also a main factor. In obese patient, we have to adjust the dose, and we have to see the anatomical structure of the patient. And next we have height. In height, taller patients require more dosage of drug, because though their spinal cord length will be more compared to the normal patient. So taller patient requires more spinal anesthetic drug dosage compared to the normal patient. And next we have technique and needle placement. If we are doing or performing any spinal anesthesia procedure in a proper way, then the blocking success rate will be more. If we are mishandling, or the if we are not doing properly, then the success rate will be less compared to the proper technique. So technique and needle placement also affect the spinal anesthesia. Next we have volume and concentration. If we give more amount of drug, the spinal anesthetic intensity will be more, and the concentration, like if we whether we are adding anything in that drug or drug or anything, that also impact the spinal anesthesia. Volume and concentration also a factor which affect the spinal anesthesia. And next we have additives and the adjuvants. In with the spinal anesthetic drug, whether we are adding any opioids, epinephrine, or like we can choose fentanyl, buprogesic, like that drug. If we are adding any of these drugs, those drug will those drug will increase the duration of the action, and they'll reduce the pain also. They'll reduce the pain, and they'll increase the duration of the action of the spinal anesthetic. So those also plays or those also impact the spinal anesthesia. Those additives and the adjuvants which we are using with spinal anesthetic drug, those also impact the spinal anesthesia. And next we have patient position. If after giving spinal anesthesia, if we are placing the patient in the um, head and low, then the drug will come to the higher level. To the it might come to the L1 or to the T5, like that. We can't predict anything. Like it will come to the more higher level compared to the required level. So that patient position also of that plays an important role in the spinal anesthesia. That's why we have to keep in mind, uh, after giving spinal anesthesia, see we should not make the patient suddenly. We should not make the patient in the head low position, because that drug will come to the higher level, and it might cause respiratory and cardiovascular problem also, complications also. And next we have spinal cord anatomy or spinal canal anatomy. If there is any stenosed or the scoliosed spinal cord, then the spinal anesthetic blockage will be very less. That spinal anesthetic blockage will be very less. And next we have CSF volume and the pressure. If the CSF volume is more, then if we give drug, then that drug will spread over the area. So if the CSF volume is less and the drug, if we are giving more drug, and the drug will be like it's more compared to the CSF na. So that blocking will be more. And if we give drug according to the CSF volume, it will manage, and that blocking success rate will be normal. If the CSF volume is less and we are giving drugs, then it will not spread, or there will be complications, like that drug might go into the systemic circulation also. So CSF volume and pressure changes in CSF can affect the spinal spread and the duration of the block also. And next we have anesthetic agent interactions. After giving spinal anesthesia, what happens? If we simultaneously, if we give any drugs like anesthetic drugs in the through the IV cannula, that also impact the spinal anesthesia. Those medications also impact the spinal anesthesia. These are all these factors which affect the spinal anesthesia. Once again, we will recall these factors. First one is type and the dose of the local anesthesia. It depends on the what drug we are using and all. And next we have patient factors. Like in a age patient, we may require lesser dose, and in weight patients, we have to adjust the dosage according to the patient weight. And next we have height. Taller patients require more drugs compared to the normal patients. Next we have technique and needle placement. If we are doing in a proper way, then this the blocking success rate will be more. Next we have volume and concentration. If we are giving more amount of drug, then the blocking rate will be more, and the intensity also will be more. Next, additive and adjuvant. Whether this also plays an important role, whether we are using any adjuvant or something, that those adjuvants will prolong the duration and they'll reduce the pain also. Next, patient position. If we are making the patient in a head low position, then that drug will come to the higher level. That also that might also cause complications sometimes. We have to monitor the patient's condition. Next is spinal canal anatomy. If that canal anatomy is like they are stenosed or scoliosed, then blocking success rate will be very less. Next is spinal CSF volume and the pressure. If the CSF is more, blocking success rate is good, and that drug will spread over the nerve, that spinal cord. And next is anesthetic agent interaction. Adjuvant like adjuvants only. If we are giving any drug simultaneously with through the IV cannula, those also impact the spinal anesthetic procedure. These are all the things which affect the spinal anesthesia. These are all the factors affect the spinal anesthesia. So thank you so much. Thanks for watching the entire video without skipping. If you haven't subscribed to Anivi Talks, please go and subscribe. And if you have any queries on this topic, please let me know in the comment section. Thanks for watching. Thank you all. Bye bye.